Do you know 80% of people who have gone into diabetes complications are the ones who have neglected their symptoms? And do you know people who have observed their early symptoms and taken action toward have reversed their pre-diabetic as well? In this video, we will be understanding 5 important symptoms of diabetes. Hello everyone, I am Subha Sitaraman, holistic wellness coach working on the mission to transform lives of diabetic. So today we will be talking about 5 important symptoms which people easily neglect. The first symptom is about dehydration. Dehydration, when I am talking about dehydration, I want to highlight one important point that is called polyuria. Polyuria is a medical terminology which means excess urination. What happens is people tend to urinate very frequently. And also people observe that while urinating, they observe a huge volume of urination. When you have all these symptoms, definitely you will need to get into a medical a diagnosis to understand your blood sugar levels. This is one of the important symptoms. Why is this polyuria happening? Why is this excess urination, frequent urination happening? That is because your blood stream is full of glucose. It is not absorbed by the cells. And what happens, it is just getting into kidney, and kidney is not able to reabsorb the blood sugar, that is the glucose, and that is why it is just flushing it out. So you tend to urinate frequently. You tend to urinate huge volume. And when this symptom is happening, naturally we will get into dehydration. And when dehydration is happening, what happens? You will feel thirsty very frequently. This is called polydipsia. This means excess thirst, excess or frequent thirst. So you tend to drink lot of water. People get confused over here. People will be saying, a lot of people will be saying, when I ask this question, do you urinate frequently? Did you had the symptoms? They used to say, I drink a lot of water, and of course when I drink water, I will need to urinate, right? Yes, but you will know the limit. We will know the limit. We will know if we are really feeling thirsty very frequently and drinking water, and during the night also we feel thirsty. We frequently wake up for urinating once in 2 hours, once in 1 hour. All that is the symptom for diabetic. That is, your blood sugar levels are not in control. You will need to observe your blood sugar levels. Even after getting diagnosed from diabetes, you will be getting these kind of symptoms when you are on medication. That means even if you are on medication, your blood sugar levels are not maintained. You will need to go for re-examination or do some modification in your lifestyle. That is the symptom for that. This is the first symptom. And the second symptom is fatigue. People, you will be seeing people will be sleeping very well in the night, but while they are waking up, they will not be feeling so fresh in the morning. And when they get into during the day, they feel like sleeping again. They are very tired, and sometimes they will have the fatigue as well. And there is one more thing when it comes to this fatigue we will need to talk about is polyphagia. What happens? The cells, why are they getting fatigue? We will need to understand that. The cells will need fuel, right? Even if we are eating idli, dosa, pungal, variety of rices we have, but for the cell, it is nothing but carbs, carbohydrate, right? And that is the sugar, that is the glucose. Glucose is the fuel for cells. It is just getting converted from the carbohydrate food, whatever we are having, right? And this particular glucose is just staying in the bloodstream and it is not entering into the cell, and that is why we call it as diabetes, high blood sugar levels. Okay, even though you eat, because of insulin resistance, what happens is cell is still feeling hungry, it is not getting its fuel at all. So what happens? We tend to eat. We tend to feel hunger very frequently. I see people who will have their breakfast and just travel to their office. By the time they get into office, they will feel so much hungry. I used to listen from my clients, lot of people saying they have their breakfast and by 11 o'clock in their office they'll be feeling too much hungry. They will not be able to work at all. If you have that kind of a symptom, definitely if you're having breakfast at around a proper breakfast at around 12:30, you will feel hunger. But even before that, and too much hunger, you will not be able to think of anything else. If that is the case, definitely your sugar levels are not maintained properly. You will need to definitely go for diabetes examination. This is the major symptoms: fatigue, tiredness, excess hunger. All this comes here. And the third one, very, very important point over here. People tend to neglect this easily. You know what? This is called, this symptom is numbness. Numbness. Especially the tingling situation, sensation, itching sensation, burning sensation in the extremities. People think the itching, tingling, burning sensation should be only in the legs, or numbness only in the legs. If it is in the legs, foot, then they call it as diabetes. If they get it in their hands, they get scared. What happens is people think like they are getting into some other problem. They related to heart, everything. Yes, of course, right? But still, if you're having the tingling sensation in the hands, itching and burning sensation in the hands, legs, extremities, definitely you will need to get into the diabetes examination. That is one major symptoms. And this connected to this is the infections, a wound which is there and it is not getting healed at all. You get infections very, please understand this point, my dear friends. If you're getting some kind of oral infections, give importance to it. Oral infections are also very, very, people tend to get frequent oral infections. Now, that is, we will need to give attention to it. All the infections, whichever is not getting cured very easily, which is having, you are having that infection for a period of time, that means you will need to observe your blood sugar levels. And the fourth symptom, very, very easy symptom, everybody knows about it, that is sudden weight loss. If you're feeling a sudden weight loss, what happens is you definitely, right, when the cells are not getting its, when you have insulin resistance, the fat accumulation will not happen. And that is why what happens is you will feel a sudden weight loss. And one more, my dear friends, when you are on chronic diabetic, it is the reverse condition. When you are diabetic for a long time, you will be put putting on. So sudden weight loss, definitely check your blood sugar levels. It would have shoot up very high. But if you are on diabetes medication, if you are on diabetic treatment, you will be putting on, and that is because of your lifestyle, and again that is the chronic diabetic symptom. Please understand this. Weight loss, sudden weight loss is very, very dangerous. You will need to give importance to that. Putting on weight during your diabetic period, we will need to work with our lifestyle modification and other things. We will talk about that later. And the fifth important symptom that, again we tend to ignore this, is blurred vision. Blurred vision. People think that their vision is blurred because of many other reasons. But when the vision is blurred, why is this vision blurred happening in diabetic? It is associated with retinopathy, diabetic retinopathy. That means our retina, the eyes, nerves, and the blood vessels are very, 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 very micro blood vessels. When the blood vessels are micro, when the blood is definitely, when you're diabetic, the blood's viscosity will be high. So what happens is that blood passing on into this micro blood vessel will definitely damage the blood vessel, and that is why you are getting this blurred kind of a symptoms, blurred vision. What happens, my dear friends, why I'm talking, maybe this you all know about it, or all of you know about these symptoms, okay, for now you would have learned it, but why I'm talking about this today is still there are people who neglect these kind of symptoms. Recently I had one of my clients. He was diabetic for some time. He was on med, but still he was having this blurred vision, and I don't know, he's not treated it, or he's not taken any action to it, and he was ignoring it. One period in time he lost his vision. I've seen my clients losing their vision due to diabetic. This is very, very serious, my dear friends. We will need to give importance to these symptoms, and we will need to take actions at the right time. Please do consult your diabetic physician, whoever is your physician, doctor, and just examine your sugar levels, discuss with him, and see what you will be able to do for that when you have these kind of symptoms. This is very, very important. Okay, and when I'm talking about the symptoms, I want to highlight, we have seen these 5 symptoms, right? And associated symptoms as well. But when we are talking about this, I want to tell you all one more important point, my dear friends, that is more dangerous. That is, people don't have any of these kind of symptoms, and that people are called as asymptomatic. It is very, very dangerous, right? So in one more video we will be talking about the asymptomatic. If you want to know about this asymptomatic diabetic condition, definitely put in the comment box. We will be discussing it in the other video. Until then, please be caution about these symptoms, and just be aware of these symptoms, and definitely you will be able to manage your diabetic levels very easily if you are observing the symptoms very well. Thank you so much. We will be meeting in another session soon. Thank you. Bye.